A research professor at Stephen F. Austin State University has applied for a U.S. patent. In this week's edition of Today's Health, we learn that the patent would be for an anti-cancer compound. And the interesting part is that proposed cancer-fighting agent is found in Texas. Matt Thibodeau reports.
Dr. Xiu Li has been working at SFA for 25 years. His accomplishments are impressive, but this time his work in pharmaceutical crops could be a crowning achievement.
The goal of the research is to identify the new molecule fighting against the cancer, human cancers.
Dr. Li and his team found something promising in a plant known to wreak havoc in Texas lakes, giant salvinia.
We finally found 8 new compounds, one of them showing anti-tumor activity.
Lab trials show this new compound could slow or even stop the growth of cancer cells. This includes pancreatic and lung cancer cells. This work has led to a U.S. patent.
His innovative research actually raises the profile of SFA. It puts us on the map really as doing some of the most innovative basic research that's probably being conducted in the country today.
With no roadblocks, this could go to market in 10 to 15 years, but it's not time to celebrate yet.
It's still early development stage. It's hard to predict the future clinical trials.
But despite this, Dr. Li, his staff, and SFA are hopeful this invasive species could be used for something good.
In other health news this morning, the flu shot is safe for people who are allergic to eggs. For years, people with egg allergies have been told to avoid the flu vaccine because it contains traces of egg protein. But updated guidelines from the Joint Task Force on Practice Parameters stresses that no special precautions are needed. Their studies show the flu shot poses no greater risk to those with an egg allergy than those without. A new study has identified key ages when having a healthy weight may prevent obesity in adulthood. Australian researchers tracked nearly 3,000 people over 3 decades. Those with a normal BMI by the age of 6 were less likely to be obese by middle age. Females who had a healthy weight at age 16 and males at age 21 also reduced their risk of future obesity. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.